Hey everyone, welcome to the Nursing Insights podcast. My name is Stephanie and I'm a registered nurse practicing in the state of New Jersey. Getting right to it, the state of healthcare right now is tough, to say the least. Let's just say that the nursing shortage does not spark joy. We can sit in that and stew in it for a while, but we can't live in it forever. Things are changing. So join me as your host as I partner with the New Jersey Collaborating Center for Nursing to hear from nurses across the state about their experiences, trials, and triumphs in the nursing profession. On this episode, we get to hear from pediatric home health nurse Danielle Kuhlwein. Danielle works in Toms River, New Jersey as a part of Preferred Home Health Care, a care options for kids company. Danielle, thanks so much for joining us today.
Oh, thank you so much for having me.
I'm so glad to have you, Danielle. Could you share us a little bit about your journey in becoming a nurse?
Sure. Well, I started in healthcare as a CNA in a nursing home. I enjoyed that. It was more or less just getting my feet wet, seeing what I wanted to do after graduating high school. And I had a wonderful, wonderful nurse who worked the unit who stopped me and was like, you would do so well in nursing. You should give it a try. And I ended up going to Ocean County Vocational Technical School here in Toms River. At the time, I think it was at the Naval Base. And I went through that program, loved it, and ended up going into home care during the program, going into agency work as a home health aide to work and go to school. Primarily stayed in agency after graduating. And eventually, while I was doing all these different staffing things, another really wonderful senior nurse pulled me aside and was like, you have a disposition for people. We really think you should give this a try. And I did. And I haven't left since. I'm going on 20 years. Crazy. And I
Amazing.
love it.
That's awesome to hear. So let's dig into that a little bit. So you were saying that in school you had the exposure to home care.
So it was one of the options, while we were going through the program, it wasn't a specialty that nursing school actually sent us into home care. It was one of those you have to go out and experience it yourself where you volunteer your time. So that's what I ended up doing is for extra, I don't know if they were considered CUs when we were in school, but when you did the extra outside of school studies, that's when I started visiting home cares and seeing how I liked it. So I went from a CNA to a home health aide to try it out. And it was a lot of fun, and it still is. So I do wish they had a little more of that experience in school for nurses because it is kind of something that you don't get to really get hands-on. But hopefully everyone out there will have a nice senior nurse like I did who lets you know what it is.
And as you started your foray into home health nursing at the time, do you remember what are some of the things that drew you into the specialty?
Yes. So being in the facilities when I was doing agency staffing relief type nursing, which great, it was exciting. It was always something new. I was one of the people that someone would get discharged and I would be like, well, what happens next? Where did they go? Are they okay? So one of the things that I liked about home care is once you found a family you fit with, you get to see that side of it. There's nothing like bringing a baby home from the NICU who's on a ventilator and really struggling and the family's struggling. You're a support for them. You're a support for the baby. And 3 years goes by and you're watching them go off to school on their bus with no trach and vent. It's amazing. So it's bittersweet, but it's really why I like home care because I feel like there's much more of an opportunity for that happy ending to see what work nurses do, how it affects them long term after they're out of those facilities, which we don't really get to see in hospitals or nursing homes and things like that.
And do you work specifically and only with pediatrics, or do you also work with patients of other demographics?
No. So that's the other part of the home care that I love so much. You can do so much. It's really evolved over the last few years what a home care agency care can provide. So I love to work with ventilators. I like to say that's my jam, but I work with adults and I work in pediatrics, which definitely keeps your skills. I know some people are afraid in home care, oh, we'll lose our skill, quote unquote. That is not the case because there's so many opportunities. So I work with children as far as taking them to school. Maybe we have vent children or people with feeding tubes who need a nurse with them one-on-one at school. I get to ride the bus and go to school and help them participate in their day. And then I also have clients where we're at home who maybe they are immunocompromised and they can't go to school. So we're more of a support for their medical needs at home, but also their therapies in conjunction with whatever PTOT, things like that. And then I transition. So this is just kind of where I'm at now. I also have a client who I actually met 20 years ago. She's the very first home care family I've been to, and I still see her to this day. I can't leave. I'm stuck. They're stuck with me. I sometimes would like to say, no, I definitely like to say that I credit her with me making it in home care, because it's a person who has everything against them, all the things you could possibly have. And she is by far the happiest person I know in my entire life. There's always sun in her world. So she's really kind of my driving force these days. And like I said, I've known her for so long. I feel like I could never leave. So it's a good variety. On top of that, we also do visits. So if there's wound care needs, depending, and you get to travel. One of the more recent additions to the nursing license is that we can now get compact licenses, which my company is encourage everyone to do, because they're doing things like Make-A-Wish Foundation, and you have nurses traveling to Disney World with their clients, and it's really so fun. It really is.
How cool. I mean, definitely not going to a hospital, when you're going to Disneyland. That's such a cool experience to be able to really be at a patient's side or at a client's side is some of the terminology you're using every area of their life, whether it's school, home, travel, camp, you had said before. So such a cool opportunity, especially for our listeners who've never been in the home care space. Could you paint the picture for us of what a day in the life of a home care nurse might look like?
Sure. I would say if you're in a home care case where you're actually in the home, because that is obviously where it all begins. The nice thing that I like is you work with a team of coordinators in the office. They get to know you, they get to know your skills, what you're interested in, and they fit you with a family that works for both you and the family, because not everybody likes everyone. So you got to find that fit. But usually you'll come in, you're doing their ADLs with them. Maybe there's somebody who needs help with specific job or therapy, like I said. So on top of doing their nursing skills, we're maybe helping them make their meals. We're helping them communicate with others. There's a lot of communication. It's big in home care. We have some clients that don't audibly speak, so we help them with their adapted devices, things like that. And then appointment scheduling, kind of all the things that we take for granted that we do on our own every day. We help the clients do that, as well as their medical needs. So I find a lot of being in home care, it's a lot of socialization. You're helping people with their daily life.
I remember you had mentioned something before about bus runs.
Oh, they're so fun. So bus runs would be great, especially for those nurses who are looking for just, maybe they need a little extra, or maybe they're not sure if they're interested in home care, but they want to see what it is. And it's kind of a newer development, I would say, in the last 3 years that I've been on them, a lot more this year. And you get a wide variety of patients. Some are preschool, some are high school. They may have seizure disorders. Some come with service dogs, things like that. And they just need somebody to be with them during that transportation period when there's not a nurse present at the school or a parent present at home. So that's a lot of fun. You can go pick them up and, maybe it's only 2 hours out of your day, but for those 2 hours, you're providing this comfy safe zone for these little kids who are just taking their first adventures outside of the home. It's a lot of fun. And then there's another version of the bus runs where you get to stay in the classroom. So if you have clients who also need tube feedings during the day and they're in a school that the nurse that's not something that she can provide, then you're staying with them in the classroom and you're doing that side of it as well. So it's newer to home care as far as my company is concerned in the last, like I said, probably 3 years, but it's really a wonderful opportunity to, even if you're not sure you want to do pediatrics, I'm not sure I want to work with kids. Well, here's just an hour or two, see if you like that, so it's really nice. And you don't realize till you do it what a big impact it has for those kids. I have someone I see regularly and there's that big smile when they see me. So it's also helping them getting ready to go to school. That's a scary thing for kids. A lot of these kids have been home, like I said, they may have been in the NICU at one point in time. So they don't get to go right away the way other children might. So they're a little bit more afraid, they're a little more nervous, but they have that familiar face to guide them into that next step. It's a really cool part of the journey.
And you say that there's kind of such a wide variety of experiences, such a wide variety of areas in which you're practicing as you're following the student, the clients in their daily life. What experiences have helped you prepare for this kind of varied role that you're in?
Well, being in home care, as long as I have just seeing the growth of the clients from the time they come home to the hospital. It sounds silly, but a lot of us get to see the first steps. We get to see the first time they eat food and speak and things like that. So there's a lot of growth at home, which kind of prepares all of us to do it together, you know? So it's like watching your little buddy go to that next grade, the next class, that next part of their journeys. It's so fun. And I would say, being that I get to do multiple variety of different things in home care, it kind of prepares you for that what if. So, I've already seen this X, Y, and Z happen, so I could be prepared ahead of time. And we get wonderful training and lots of support. So, there's always, especially as LPNs, I know that, at least I feel that it's crucial to really know that you have a team behind you. They may not be with you in the daily life in the home, but they're a text, a phone call, 5-minute drive away. There's some really great support out there for us.
That's a great segue into the next question I had for you, which is just what are some of your favorite aspects of being in home care?
For me, well, like I said, I do love my team. I don't work side by side with people like you would in a facility, but I have a really wonderful, wonderful team of office staff. I have coordinators and nursing supervisors, vent trach educators. And I love that even though you're not necessarily with those people every day, it's a little family unit. They know who I am. They know what I'm looking for, what I'm interested in. And as you're in home care, the longer you're here, you'll find, oh, this is something I really like to do. Maybe hospice isn't for me. I can honestly say that. I'm one of those people who likes the daily joy and it just hurts my heart too much. But I had a great team of people sit with me and through the years and they helped me find those cases. So I really love that. And I love a happy ending. I'm not going to lie. I love to see kids decannulated and breathing on their own and joining the world out there, getting to have the socialization they might not have had if they were still in a hospital. And then as far as for my older clients, the activities you get to do in home care are so fun. I'm not going to lie. We just recently had a client go to the Tim Tebow Foundation prom, I believe it was. So you're going to events like that. Some of our clients do horseback riding for therapy. So you're outdoors with them, or maybe they're going to a camp. The family wants to go to beach on Saturday and you're scheduled. Well, get your shoes and let's go. We're all, I love that there's never a repeat. Every day is different, but it's nice because you've now established that comfort level with each other. You're not afraid to do something different the next day because you got that relationship with them.
And I know you've shared before that some of those relations run really deep. You shared with me in one of our previous conversations that you even had one of the parents of one of your clients come to your own wedding.
She did. She did. I was with them for 3 years, very similar, where he came home, their son came home vented and trached with a feeding tube. And 3 years later was walking around, no ventilator anymore. And it was coming to the end of nursing services, transitioning into school. Happy for him. He didn't need a nurse anymore, but bittersweet as always. And I had just been engaged and they said, oh, we're going to miss you so much. And they ended up coming to my wedding. It was so nice to still see them. And I feel like I have a lot of stories like that where there's families that even after the nursing ends, they cross your mind or you'll see them in public and, you get that big hug and how's everything going? And it's just so nice. I also had a family that I was out for, I think 4 months after I had my second child who sent me cards in the mail, just thinking of you, little cards, things like that. So it definitely runs deep. You think about them often. I would say that the hardest part of that though is it's bittersweet when they no longer need you. Because you were there for all the big milestones and you're so proud of them and they're off and on their own now, but they're so young when you're there that I find that when that boy in particular I was talking about, I think he is 12 now, has no idea who I am. So it's a little like, oh, dry your eye. You're happy that he doesn't. You're happy he doesn't remember how hard it was at one point in time, but it still tugs on the heartstrings.
And still, what a big difference from the relationship you might develop with a patient in a critical care setting or an acute care setting where you might see them for 3 days. This is a family that you've gotten to know over the course of years, and you really develop that interaction, that daily rapport of being able to get to know them and be integrated into their lives. So what a beautiful opportunity to really engage in the connection that is just a core part of being a nurse. So that is so awesome, so wonderful. And I believe one of the things I've heard that's also a great aspect of being in home care is just the type type of scheduling you get. Could you tell us a little bit about that?
I would not be lying if I didn't say that that makes a huge difference. So anyone in nursing or in the medical field, we're used to those 12 hours, 3 days a week, kind of everybody's expecting it schedules. But I can tell you, right, like an example for me, because there's such a variety, I have one home that I go to 16 hours, another that I only go to 6. I do the bus runs for 3. It's really like what you need in that day. There's always someone to provide. So you have, maybe you are a student nurse right now and you only have 4 hours, but you really need a little extra. You call them up and I can almost guarantee that there is a visit or a bus run situation that covers that. So it definitely is easy in that aspect. And for someone like me who has young kids, it's so much easier to work around my children's school schedule, because if I know I do my schedule every month, so a month in advance. And if I know I have a class party one day, well, that's the day that I can't take 16 hours, but nobody's mad about it because there's 100 of us waiting for more, so there's always an opportunity. I find that the scheduling is really a huge draw, especially once you get to that time in life where maybe you're going back to school or maybe you have started a family and life is busy. We're busy people. And it's nice to know that you can make a schedule that works for you and it helps others.
Absolutely. And it also sounds like you're saying it's more of a team effort than somebody might expect. So even though you may be at a house on some days of the week, it might be another team member on other days of the week. And they may also have the same relationship, the same time, spending years with a family, with a client, where you become a team together. You're able to cover each other. You're able to show up when another person needs a day off. So it sounds like very much a team effort.
Yes. And I do have, like, the house that I have been with the longest, I think there's 12 of us in total. And throughout the years, we all now know each other, and very similar. Everybody's at a different stage in life, some with older kids, some with younger kids, some who are just traveling the world, and this is what they do in between. And we all kind of work together. We still go through our company, obviously. They schedule it for us. But once you know your coworkers, it's such a nice thing, because okay, maybe I'm off on this day, but so and so is always looking for those days. So it's really a good group of people. I'll honestly say in all these years, I don't have any horror stories about a group of nurses I didn't like. We all work together, and it's usually a great team effort. And I would like to say the one thing I think is great, I do a lot of orientations to new houses with nurses, and I tell them all the time, we're not the same. None of us are the same. What I bring to the table may be different than what this other person brings to the table, but that variety in your staff, even though you're seeing them every week and you have that steadiness to it, it makes the day better. A lot of the clients don't get to leave their house the way you and I leave our house. So the personality coming in the door sets the tone for that day. So it is a really great thing. Yes, you have the continuous care of the same people you see every week, but everybody's different. So I might bring a game for a kid and another nurse might bring something completely different for them. It's a good mix. It's like having 12 sisters in your house. all finding.
It sounds like fun. That sounds like a good time. And that really highlights, so that difference in, you're still a team, even if you're not in the house all at the same time. That highlights one of the major differences between home care and maybe some of the other spaces you find nurses working together. What are some of the other differences that you may see or that you may, experience as a home care nurse versus other facilities or other experiences in clinical settings?
All right. Well, like you said, it's definitely, the team is a little bit different because you're not working side by side. I will say that the level of confidence in my coworkers is a lot higher than it was with the nurses that I work with in the facility. And I'm sure they're all wonderful people. I'm not discrediting that in any way, but because you're on your own in home care, I tend to see that these are more confident nurses. They're aware of all the rules and what they're doing, when they're doing it at all times, because you have to be able to think on your feet. You don't have that like emergency button to push anymore. I find that I'm much more comfortable with the staff that I work with. I'm confident that when I'm leaving my client in a certain condition, the next person coming in is going to do the same. Or if I'm receiving a report from someone, I'm not questioning, was X, Y, or Z done? Did they have time for that? Of course they had time. They're with one person. It's a lot of a bigger level of confidence in my coworkers, and the same with my supervisory staff. I felt a lot in the facility, especially in the nursing home. I worked third shift, and there wasn't always someone there. There wasn't always someone to call. And, I get it. It's busy. It's a lot more people, but it doesn't matter what shift I work in home care. If I have a question, someone answers the phone. Maybe they're not down the hall, but somebody will 100% have an answer for me. And I love that we can utilize all of our support staff. It's not just necessarily the DON who answers. We have multiple nursing supervisors. Like I said, we have a vent trach educator who herself during COVID came to my home to make sure that my refresher was done because I wanted to make sure that I knew the vent that I was going on. She's a wonderful, wonderful lady. And she called me up and she said, "You want me to stop by?" And she brought everything right here in my own house and reviewed it all with me so that I could be confident in what I was doing. And to me, that's a big thing because you are the personality in the house that day. So as much as your skill matters to us, our skills matter to us. We want to know that we're doing our nursing correctly. Sometimes the little kids want to still see that smile. So you have to, you want to make sure that you could do both. So I really love that. I love the support of my supervisory staff and the families. I would be lying if I didn't say the family dynamic in home care is so much nicer than that in a facility. And I do realize a lot of that is to do with that in a hospital. It's not always the happiest time for someone to be there. I do understand that. Same with the nursing homes, but the families in the home, they're so happy you came in. They're happy they have someone, they want to be able to live their daily life with their family and know that their family member is safe. And so I really love that side of it as well.
So glad to see that the support is robust and that the atmosphere is positive. Those are wonderful things to hear about home care. Would you be able to share a little bit about some of the challenges that are different?
Oh, of course. So every coin has two sides, right? The happiness of it is always a positive, but I would say that the other side to being alone is you are alone. You are the only one in the home that day. There's no code team to call. There's no one right down the door to just say, "Hey, can you look at this as well?" So when we start a home care case, you'll get an outline of what's expected. Your supervisor will go over all the parts of the case that you will need to be doing throughout your day. And sometimes you'll see something on there and you're like, "Wait, I haven't done this in a couple of years," So you have to make sure that you're reading through everything prior to going to a home. It is nice to know what to expect, but that doesn't always mean that that's what's really there. So I'll say that's the other hard part of it, especially when they're opening new cases. They can have everything written out on paper, but then you walk in and it may not exactly be what they said. So that's where I use that support staff. So that's a big challenge. Being alone can be a challenge, especially in the beginning. And establishing the relationship that you need to last in home care with clients by itself is its own adventure because not everyone likes everyone. And that's the truth. So as much as it's about choosing what we want and what kind of care we want to provide and what kind of cases we want to go to, not every family member wants that smiling, bubbly face all the time. So you have to be able to work through those bad days with someone and not take it too personally, because that is the downside to having such a personal relationship is you want to make sure that you yourself aren't taking it personally because it's their life. We're there for that 8 hours or 4 hours or whatever it is, and we go home. So not everyone's happy all the time. So that's for sure something that I would say was one of the things I struggled with in the beginning because I tend to be a very happy person. So, what do you mean you're having a bad day? So I know that's silly, but it is something you have to work through. And I would say that as far as your skills, so, we all have to do our CEUs every year, but I always make sure that it's in something that applies to what I'm actively doing, make sure that you're keeping up on those things. The emergency is in your hands until 911 arrives and it's only you. So that would be the harder side of home care. Again, on that personal level is when it's over. When it's over, you've established such a relationship that sometimes that's hard as well. It's definitely a give and take. Luckily, I do feel like it's more of a positive than a negative, but those would be my big ones.
You've done just such a beautiful job of characterizing home care as this specialty in which you are independent, you're doing something new every day, you're building these strong relationships with your clients and their families, you keep your skills sharp, and you have such a variety of spaces in which you're practicing, experiences in which you are engaging with, from Disney World to the bus to the school to taking somebody home from the hospital for the first day of their life. So it's such a cool experience to hear about home care from you, Danielle, and we're getting close to the end. So I'd love to ask, on behalf of our listeners, if somebody's interested in home care, how might they get their toes wet? How might they start to dip into the field of home care?
For sure, for sure. Well, I've said it before, I always say try new things, try all this stuff. But for first time people, once you've found a home care company that you're interested in, you go through the training. My big spiel to everyone that I orient out there is there's never too much training. Train away, meet everyone. If you're not sure that that's how it's supposed to be done, ask. We're all really nice, I promise. And we were you once, so we want to help. And that's a big thing. I love to say that if you think you're interested in a specific kind of home care, try it. And don't be upset if it didn't work for you. There's so much more to do. There's so much more to try. Talk to your coworkers, because that's how I got into it anyway. I had that one nurse who was like, you could do it. So talk around, listen to others. I like being in the home the most. So if you can find that family that fits with you and you fit with them, it's really going to be a highlight for you. I know it's going to bring joy to your day. Sometimes it's a good thing to go to work, You
go to work, you do all this amazing care for your patients, you participate with them and engage with them. When you go home, how is it that you like to take care of yourself?
I'm a very active person. So I'm a gym person. I kickbox. My kids and I love to just be silly and dance and decompress together that way. There's always a need for an outlet, right? So find that thing that brings you joy at the end of the day and just take that hour for yourself. And that's kind of what I do. I make sure to get that sun on my face and get the blood pumping, right?
And Danielle, is there anything else you'd like to share about your experience as a home health nurse?
I just would like to say that I feel like it's an unsung section of nursing that people don't really know a lot about. I'm glad for the opportunity to share that with everyone, because it really is a joy to have a job that you love.
Beautiful. Thank you so much for joining us, Danielle. It was a pleasure chatting with you on this podcast, and we will see you all next time on the Nursing Insights podcast. Thank you.
Thank you.
Thanks for listening, everyone. We'll see you next time on the Nursing Insights podcast.
This podcast is brought to you by the New Jersey Collaborating Center for Nursing and the Rutgers School of Communication and Information.